Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Let's look at some teratogenic drugs. So there is teratogenic drugs, and we will be looking at the birth defects. So the first drugs we're talking about will be the penicillamine. So penicillamine, it results in the cutaneous laxa syndrome, cutis laxa syndrome. Next is lithium. This is important. So lithium leads to the Epstein anomaly. Then moving on to the progesterone. It leads to the masculinization of the fetus. The isotretinoin. Isotretinoin is involved in the facial or the ear anomalies. So face ear anomalies. It can also lead to the heart disease and the CNS abnormalities. Next, what about quinine? The quinine is involved in the abortion as well as thrombocytopenia and deafness. So abortion, thrombocytopenia, as well as the deafness. Next, moving on to the topiramate. The topiramate, it results in the cleft lip. So what about valproate? This is again important. The valproate, it results in spina bifida. So the spina bifida, there is also some limb defects. So spina bifida, limb defects, there is ASD, that is autism spectrum disorder. Facial and cardiac anomalies, there's coarctation of aorta, as well as aortic stenosis, pulmonary atresia, and the ventricular septal defect. Then talking about the vitamin D. Vitamin D is involved in the SAS. SAS here stands for the supravalvular aortic stenosis. Then moving on to the warfarin. Warfarin, it causes the nasal disturbance. That is warfarin. It may result in the fetal bleeding, as well as the hypoplastic nasal structures. Then looking at statins, it is known for the vactral defects. So what is this vactral defects? So vactral defects, V stands for the vertebral, A stands for the anal, and C for the cardiac. Then comes the tracheoesophageal. F for the fistula, A for the renal, R for the renal, A for the arterial, and L for the limb. Next is phenytoin. Phenytoin, it can result in, this results in the VSD, ASD. So this VSD, there can be ASD. There also can be the coarctation of the aorta, as well as the PDA, patent ductus arteriosus. Next, moving on to the ACE and the ARBs. So ACE and ARB inhibitors. ACE inhibitors, ARBs, they result in hypoplasia of organs, anuria, as well as irreversible renal failure and hypoplasia of the organs. And talking about the carbimazole, the carbimazole or the methimazole. So this is involved in the choanal atresia, aplastic cutis, as well as the tracheoesophageal fistula and the fetal goiter. Then talking about alcohol. Alcohol, most commonly it may involve the ASD, that is the atrial septal defect, as well as VSD, that is a ventral septal defect.